you're saying about it's headed towards 90% of physicians being part of like larger groups, hospitals mostly.
Yes.
And they're going to have a full whole system and a whole department of MBAs that are going to be able to figure out all the things that need to be done. You're going to try to do that within one person. Uh, you know, obviously that's what we do here. We're media trying to compete with larger media that have, team of lawyers, team of accountants, team of this. So you have to, basically operate on your own and be fairly well-rounded. We have over 100 small businesses that are with us that are, to me, are the heroes of the economy, and that they have to know all of these things. But I got to tell you, that's a lot for one person to take on.
That's correct. So what this is how my vision for the future is. If you ask me, how do you think as a single physician, a woman, a mother, you would be able to run something like this? So I have to tell you that I have amazing women in my staff, from my office manager, Judy Mayer, to my excellent nurse practitioners. And we actually have one man in our group who recently joined us as a nurse practitioner. His name is Brian Cross. And all of us have become such a good team. So we're almost close to 20 staff in this small office. But my vision is not that we are going to monopolize healthcare. It's not possible. We want to run a program that can be seen by others as a pilot program where physicians who are on their own can deliver better than the standard of care, can deliver better communication to our patients, and then I would also be able to be directorial to my colleagues. I don't want to see the desperateness that I see now in my physician colleagues. I am an optimist, but just being an optimist is not enough. I need to have the resources to be able to help my physician colleagues get through this changes in healthcare delivery and continue to be the physicians that they want it to be. So it will be being a clinician, but also being administrative and directorial in future.
All right, and we're getting to the core of some of these issues right here, and you guys call in on a regular basis. If you have any other calls, do it right now because we're getting near the end. But 219-845-1100, what do you think of this? What do you think of the doctor's basically philosophy? She's going to try to go it on her own, and she is going to take the MBA and try to be the rugged individual in America. Now,
but I have to tell you this, though, Jim.
Sure.
I do not need an MBA to run my practice, though. My practice is already where it should be, and we just want to expand that. The MBA will give you the ability to understand, in a wider sense, the healthcare policies, the healthcare delivery system. It's going to become patient-centered healthcare delivery, and it is going to become what we call managed care. There is going to be healthcare cost that needs to be cut. How can you do that? By making sure that you improve your healthcare outcomes. So it's going to be significantly different algorithms that you need to understand. It's just not your intelligence or your knowledge in medicine.
Doctor, one last comment. We sit here and talk a lot about the Affordable Care Act coming onto the scene and the amount of confusion that people are having right now. Do you see that in your practice?
Absolutely. More than patients, I think physicians themselves are extremely confused. And the confusion is because it is the unknown factor in this that causes the confusion. To me, the more you know, you recreate yourself in any business. You know that you have to recreate yourself every day. So that you have to expect changes. And yes, changes are going to come, and I think these are inevitable changes, and these changes are going to stay in healthcare. Most important part of it is that the healthcare cost has to come down. Number two, the reimbursement has to be based upon performance, not volume. It's not that if I can see 40 patients instead of 20, I make more money. It's if I can see 20 patients but get my patients to do better, I get better reimbursement. This is how it's going to be. It's payment for performance.
I've never heard of that in healthcare.
That is what it is now. It is called payment for performance. So there's a lot of algorithms and software being developed now for major organizations to really assess each physician's productivity based upon the outcome of the patient.
Thanks a lot.
Thank you.
All right, Dr. Tilak, thanks for coming in.